Hello, everyone, and this is the very first episode of the Puddin podcast. This is where I will be discussing various topics and giving my opinions and feedback on them. And hopefully, once a week, I'm going to choose a different topic and hopefully go from there. So, this is just going to be for listening value, and you can listen to it, going to sleep, on your way to work, etc., whatever you want to do. Um, Today, I'm going to be talking about mental health, various mental disorders, certain ways you can cope and help them, and basically, I'm just going to be going through and giving my thoughts and opinions and facts about various mental issues that people have. And it's a very, very relatable subject because it really, in my opinion, it just doesn't matter who you are. Everybody has their very own depression, and I mean it can be one form of it, and which isn't as strong as another form of it because people have different. There's a lot of different variations of depression, and basically what I'm about to do is going to just talk about facts about it, and everybody that the people that doesn't have the depression, which is as strong as others, may not know how serious it affects a human being and affects their mind because it it changes people and it can influence bad decision making. And basically, what is depression? Everybody occasionally feels blue, sad, etc., but these feelings are usually fleeting and pass within a couple of days. When a person has depressive disorder, it interferes with daily life and normal functioning, and it causes pain for both the person with the disorder and those who care about him or her. Depression is a common but serious illness, and most who represent it need treatment to get better. Many people with depressive illnesses never seek treatment, but the vast majority, even those with the most severe depression, can get better with treatment. Intensive research into the illness has resulted in development of medications, psychotherapies, and other methods to treat people with this disabling disorder. And it's not, in my opinion, it's not just the treatments that can help you. You have to literally have the mindset, like in your mind, you have to have the mindset that these treatments can work. Or if you're going in with a mindset that they're not going to work, it's not going to work. You have to be put in the mindset that you're going to get better. But it's not that easy for everyone. Everyone just can't snap into that, thought process that I'm going to be better. It's harder for others. That's why there's different forms of depression. The different forms is, well, there's a very wide spectrum. There is major depressive disorder, dysmic disorder, which is another word for dysmia, I think it is. Sorry. There's psychotic depression, postpartum depression. I think there's something seasonal affective disorder, which that is it's characterized by the onset of depressive illness during the winter months. So people can actually get depressed just from the weather. It gets very, very specific with different types of depression. A lot of people had no idea there was these forms of depression. And people can get sad. I mean, everybody feels this way. I mean, in my opinion, is that there's literally a form of depression just from the weather being bad. And everybody feels bad on a rainy day. There's bipolar disorder, and basically a lot of people can't even see the signs of depression even in themselves. Sometimes it's so subconscious, that it's so far in the subconscious that you don't realize that it's changing you as a human and how you think. Symptoms include for depression is persistent sadness, anxious or empty feelings, feelings of hopelessness and or pessimism, a feeling of guilt, worthlessness, helplessness, irritability, restlessness, loss and of interests or activities or hobbies that were once fun, um, fatigue, decreased energy, difficult concentrating, uh, remembering details, making decisions, insomnia, early morning wakefulness, and excessive sleeping. Um, a lot of that is the main forms of depression. I mean, there's also more, which is like overeating, appetite loss, thoughts of suicide, suicide attempts, persistent aches, pains, headaches, cramps, digestive problems, etc. I mean, the list can go on. There's a lot of like people that have anxiety disorders or people with post-traumatic stress, which is PTSD. They're especially prone to having occurring depression. And PTSD is a very serious one because it's a debilitating condition that can result after a person experiences a terrifying event or ordeal. Anything, it could be violent assault, natural disaster, accidents, terrorism, or anything. And people see this, and I mean, it gives them all these forms of depression because they can't get it out of their mind. Um, I don't want to get too personal with specific things about myself, but for the past few years, I mean, everybody has their ups and downs, and sometimes their downs get really down to the point where it's just you think you really cannot go anymore. And it's I wouldn't say, in my opinion, I wouldn't say that it's necessarily 100% unhealthy to have feelings that you just can't take it anymore, because having emotions is human. I mean, you're not going to go your entire life without feeling terrible. Because if you do, then I mean, you're probably going to be literally the only one. Sadness, loss, pain, it is life, and you could just consider life as one of the subcategories under depression. I mean, it's natural, and you have to have the mindset that these things happen, and you have to be prepared for it. It's hard. It is hard. It's insanely hard. It's difficult. But message friends, talk to family, make new friends, message new people, talk to people. Place yourself around people that give off very good vibes and make you feel happy. And just focus on that. Focus on being productive. Focus on accomplishing your goals. Set small goals for yourself and set bigger ones as you progress. And you'll find that life can be as easy as you make it. And that is like a broken record, and that's something you hear all the time, but it can be as easy as you make it. But you always have to be prepared for heartache, because it's just going to happen. Let's talk about what causes depression. And there's not a single known cause of depression. I mean, rather it's likely results from a combination of genetic, biochemical, environmental, and psychological factors. And I've done research, and research indicates that depressive illnesses are disorders of the brain. Brain imaging technologies such as magnetic resonance imaging, which is MRI, have shown that brains of people who have depression look different than those of people without depression. The parts of the brain responsible for regulating mood, thinking, sleep, appetite, and behavior appear to function abnormally. In addition, important neurotransmitters and chemicals that the brain cells use to communicate appear to be out of balance, but these images do not reveal why the depression has occurred. Some types of depression tend to run in families, suggesting a genetic link. However, depression can occur in people without family histories of depression. Genetics research indicates that risk of depression results from the influence of multiple genes acting together with environmental or other factors. In addition, trauma, loss of the loved one, difficult relationships, or any stressful situation may trigger a depressive episode. Subsequent depressive episodes may occur with or without obvious trigger. So, depression can spawn from literally anything. There's there's so many ways that a person can be depressed, as I was saying at the beginning, that there's so many forms. Some are not as bad as others, and some are very, very bad. And categorizing the two is like, you don't want to say that just somebody that has an easier form of depression than another person, it doesn't mean that they're better in any way. It just means that they haven't experienced what the others experienced. And you always have to be aware of everybody constantly. Having it goes back to the same thing, is that if you want respect, give respect. And it's very hard to do. Not everybody's a saint at it. But everybody has been through something in their life. Everybody. A lot of people have been through worse things than others. But don't talk to someone as if they haven't been in your shoes, because it's not fair. And it's even if you think that you have been through more pain than another person, just openly just saying how much stuff you've been through and how they haven't. They don't know how you feel. They don't know how it is. It's wrong to do that, even though you have been, in your opinion, in way more issues than they have. Just don't be upset with other people because of that. How do women experience depression? Because it's completely different with women. A lot of men don't understand that women have their emotions are completely different. And some things that, men could get over in a few minutes, a woman will hold on for years. And that's how serious it is. And a lot of guys don't understand that, but men's depression can also be different than women's, and some women can get over things faster than men can. It's just different things. Depression is more common among women than among men. And biological, life cycle, hormonal, and psychological factors unique to women may be linked to women's higher depression rate. And researchers have shown that hormones directly affect brain chemistry that controls emotions and mood. For example, women are particularly vulnerable to depression after giving birth, when hormonal and physical changes, along with new responsibility of caring for a newborn, can be overwhelming, and many new mothers experience a brief episode of the baby blues. But some will develop postpartum depression. It can develop afterwards, even after they've had the baby, even after they've, had the baby for a month, 2 months, even longer. It can grow. Some studies suggest that women who experience postpartum depression often have had prior depressive episodes. Some women may be susceptible to severe forms of premenstrual syndrome, which is PMS, and sometimes called premenstrual dysphoric disorder, which is PMDD. And it's a condition resulting from hormonal changes and typically occur around the ovulation and before menstrual begins. And during the transition into menopause, some women experience an increased risk for depression. And scientists are exploring how the cyclical rise and fall of estrogen and other hormones may affect the brain chemistry that is associated with depressive illness. And also, women face additional stress, of work at the house, responsibilities, caring for children, aging parents, abuse, poverty, relationship strains. It remains unclear why some women face enormous challenges that develop depression, while others with similar challenges do not have those forms of depression. Some women don't experience that at all, and it always goes back to the brain. And some people, their brains, like we were talking about earlier, some people's brains are different than other, and some are more subjected to having these disorders than other people. But with men also, they experience depression maybe a little bit different than women. Men often experience depression differently and may have different ways of coping with the symptoms. Men are more likely to acknowledge having fatigue, irritability, loss of interest in certain activities, sleep disturbances, whereas women are more likely to admit to feeling sadness, worthlessness, and/or excessive guilt. Men are more likely than women to turn to alcohol, drugs when they are depressed, or become frustrated, discouraged, irritable, angry, and sometimes even abusive. Some men throw themselves into their work to avoid talking about their depression with family or friends, or engage in reckless, risky behavior. And even though more women attempt suicide, many more men die by suicide in the United States. A lot of people didn't know that. But children, what really gets me is that it's not just, older teens, older adults that have these things of depression. Even kids can have depression. Scientists and doctors have begun to take seriously the risk of depression in children. And research has shown that childhood depression often persists or reoccurs and continues into adulthood, especially if it goes untreated. The presence of childhood depression also tends to be a predictor of the more severe illnesses in adulthood. A child with depression may pretend to be sick, refuse to go to school, cling to a parent, or worry that a parent may die. Other children may sulk, get into trouble at school, be negative and irritable, and feel misunderstood because these signs may be viewed as normal mood swings, typical of children as they move through developmental stages. It may be difficult to accurately diagnose a young person with depression. Before puberty, boys and girls are equally likely to develop depressive disorders. By age 15, however, girls are twice as likely as boys to have depressive episodes. But the main topic that I wanted to talk about today was, how is depression detected and how is depression treated? Because mental health is a very serious issue. A lot of people don't consider it in their lives. They want to ignore that they may have certain mental disorders, or they want to ignore that they have depressive tendencies. And in some way, that can work. I mean, if it works for you and you get by day-to-day life and you're productive, then, go for it. Some people, though, that turn a blind eye on how they are as a person, it can become very unhealthy to themselves. It can become unhealthy to their friends, relationships, family, anything. But how it's detected, depression, even the most severe cases, is a highly treatable disorder. And as with many illnesses, the earlier treatment can begin, the more effective it is. And we talked about this. The first step to getting appropriate treatment is to visit a doctor. Certain medications and some medical conditions, such as viruses, thyroid disorders, can cause some of the symptoms as depression. A doctor can rule out these possibilities by conducting physical examinations, interviews, lab tests, and if the doctor can eliminate a medical condition as a cause, he or she should conduct a psychological evaluation or refer a patient to a mental health professional. A doctor or a mental health professional will conduct a complete diagnostic evaluation, and he or she should discuss any family history, depression, and get a complete history of symptoms. When they started, how long they have lasted, the severity, and whether they have occurred before, and if so, how they were treated. And he or she should also ask if the patient is using alcohol, drugs, etc. Once diagnosed, though, a person with depression can be treated with a number of methods, and the most common treatments are medication and psychotherapy. Medication can consist of antidepressants. They work to normalize naturally occurring brain chemicals called neurotransmitters, which we were talking about earlier, notably serotonin and other things. Other antidepressants work on neurotransmitters dopamine, and scientists studying depression have found that these particular chemicals are involved in regulating mood, but they are unsure of the exact ways in which they work. And my issues, not certain issues, but my thoughts on dopamine is that if you don't know what dopamine is, if anybody's listening, dopamine is what is the things in your brain that happen whenever you feel good or feel positive, or if you're having an excited moment, you're feeling very, very happy, you're feeling upbeat, productive, you're feeling great. That's dopamine in your brain that's being used. And a lot of people that's on depression, they have these medications or they do these other type of things that increase dopamine, increase it. But if you constantly increase something that makes you feel good, your body's going to start needing whatever you're using to increase it. Your body's going to want it more and more, and it's going to take more and more to get dopamine into your brain. And so people can sometimes even get worse even after taking medications for it. It always depends on the individual. But the newest and most popular types of antidepressant medications are called selective serotonin reuptake inhibitors, which is, I know is a very long word, but it's SSRIs. They include fluoxetine and a bunch of other drugs and everything, and they are more popular than older classes of antidepressants such as tricycles and named for other chemical structures. They or supposedly they do more. There's still studies that's being tested for new various medications. Like there's medications all the time being made for depression. For all classes of antidepressants, though, patients must take regular doses for at least 3 to 4 weeks before they are likely to experience a full therapeutic effect, and they should continue taking the medication for the time specified by their doctor even if they are feeling better, in order to prevent a relapse. Relapses can come back even harder than whatever you had in the beginning. Um, Relapsing is serious, and that's why you have to constantly be aware of yourself. And even if you are getting better, the next time you have a relapse of depression, it's going to be worse than whenever it was before. It's going to be every time. So always be aware of how you feel as an individual, and always, talk to people about how you feel. And if you have, a therapist, talk to your therapist, explain to him. Um, Medication should be stopped only under a doctor's supervision, and some medications need to be gradually stopped to give the body time to adjust, although antidepressants are not habit-forming or addictive. Abruptly ending an antidepressant can cause withdrawal symptoms or lead to a relapse. Some individuals, such as those with chronic or recurrent depression, may need to stay on the medication indefinitely. A lot of people that were taking antidepressants and certain medications for a long, lengthy period of time that just stop, it can lead to very serious relapse, which could, consist of them having suicidal thoughts, etc. There is though, I mean, antidepressants don't work 100% of the time. There's a lot of side effects. Sometimes there's headache, nausea, insomnia, nervousness. That's Insomnia is basically just trouble falling asleep or waking up often during the night. They may occur the first few nights, first few weeks, but often subside over time. There's agitations, and there's also sexual issues, and both men and women can experience the sexual problems, including reduced sex drive and etc. You can also have dry mouth, have constipation, bladder problems, sexual problems, already said that, and blurred vision and drowsiness. It's always a risk whenever you take any kind of medication. There's always side effects. Sometimes they help, sometimes they don't. Um, Basically, if you, I know this is completely off topic of medications and all, but a lot of people, there's some people that I know that when they were taking the medications, like they were, taking treatments, people take treatments from, psychotherapy treatments. taking, having therapy, they're taking their medications, everything's going good. And sometimes they can create their own depression because they hate, doing this. They hate living this lifestyle of taking medications, and they hate the lifestyle of talking to a therapist. Like, they don't want to be in this lifestyle. So it creates a even different form of their own depression. And even when they're trying to get better, they can also be getting worse in a different aspect of their mind. And it's very, very hard to just fall into things like that, because you sometimes you don't even know you're doing it. Psychotherapy, there's a lot of different types of it. There's, talk therapy, which can help people with depression. Some regimens for psychotherapy, short term, 10 to 20 weeks, and other regimens are longer term, depending on the needs of the individual. And two main types of psychotherapies, cognitive behavioral therapy and interpersonal therapy, have been shown to be effective in treatment of depression. By teaching new ways of thinking and behaving, CBT helps prevent change in negative styles of thinking and behaving that may contribute to their depression. For mild or moderate depression, psychotherapy may be best treatment option. However, for major depression of certain people, psychotherapy may not even be enough. And studies have indicated that for adolescents, a combination of medication and psychotherapy may be the most effective approach for treating major depression and reducing the likeliness for reoccurrence. There's even stuff called electroconvulsive therapy for cases in which medication and or psychotherapy does not help alleviate a person's treatment resistance to depression. The electroconvulsive therapy may be useful, formerly known as shock therapy. Like, it's a thing. It's a thing, but it's not something that happens a lot. But there's even that kind of therapy, and it's crazy in my opinion. There's efforts and there's other things to improve treatments. Researchers are looking for ways to always better understand and diagnose and treat depression among all groups of people. And new potential treatments are being tested and give hope to those who live with depression that is particularly difficult to treat. And researchers are studying the risk factors for depression and how it affects the brain. We're going to be closing out here in a little bit. I want to talk about a few more things. Everybody has a friend or a family member, even that you could have a person you're in a relationship with. You've always seen somebody that may have depression or other mental disorders or anything. And if you know someone who is depressed, it always affects you too. And the first and the most important thing you can do to help a friend or relative who has depression is to help him or her get an appropriate diagnosis and treatment. You may need to make an appointment on behalf of your friend or relative and go with him or her to see the doctor. Encourage him or your friend to stay in treatment or to seek different treatment if no improvement occurs after 6 to 8 weeks or more. To help your friend, your relative, your spouse, etc., offer your emotional support, understanding, patience, and encouragement. It's very hard sometimes to handle someone who has that, because you do not understand everything about what they're going through mentally, because your mind, is not theirs. You do not understand it. It's harder for you, and they're sitting there and they can even explain it to you thoroughly, and sometimes they can't even explain it. So just have complete patience with them, and it's hard and sometimes you can mess up, but just try your best to be patient and show encouragement. Engage your friend or relative in conversation. Listen very carefully. Always listen. There's so many things that you know as an individual, but there's a lot of things that you don't know. Always listen to people. Hear what they have to say. You can always learn. Constantly live your life with your cup half empty. Never disparage feelings your friend or relative expresses, but point out realities and offer hope. Never make out like, their feelings are not true, or not real, or not right. Never ignore comments about being suicide, and tell them to your other friends or relatives, therapists, or the doctor. This is very serious. Even though you love and care about the individual, if they talk about these things, it needs to be addressed. It's very serious. Invite your friend, your relative, or anybody out for walks that have these sort of issues and outings, other activities, and keep trying if he or she even declines. But don't push him or her to take on too much too soon. Although diversions and company are needed, too many demands may increase feelings of failure. So sometimes, even when you ask somebody if they want to do something, if they say no and you keep going, just push a little, but not a lot. But if you do too much, like every day, every day, every day, asking that individual to do something, let's go do something, it can make them feel like you're putting way too much of your life effort into them, and they don't like that. Sorry. They can feel even worse depression because they know that so many people they can feel as a burden, if it makes sense. They would feel as a burden, and it's really hard to work with someone sometimes, but like I said, it goes back to patience. Have patience. Remind your friend, your relative, or whoever it is that time with time and treatment, the depression will lift. It may not necessarily go away. Like I said, everybody has depression. Some is harder than others. But also, if it's not just your friend, it can be you that can have the depression, and you may not have no one. And to the people who have depression, listen carefully. Engage yourself in mild activity and or exercise. Go to a movie, ball game, another event, or activity that you once enjoyed. Do something that makes you happy. Participate even in religious, social, or other activities. Set realistic goals for yourself. Break up large tasks into small ones. Set some priorities and do what you can as you can. Don't rush yourself. Don't push yourself to the edge. Do what you can. Set your own pace. Try to spend time with other people and confide in a trusted friend or relative, and try not to isolate yourself and let others help you. Expect your mood to improve gradually, not immediately. Do not expect to suddenly just snap out of your depression. Often during treatment for depression, sleep and appetite will begin to improve before your depressed mood lifts. So depression is very, very strange because, like I was talking about before, even with medications, even with doing these own self treatments of doing more activities, your mind can trick itself into thinking, well, I'm better, and then you just stop and go back to your old routine, and then everything will come flowing back. Stay with a productive pace. Always have something planned for yourself. Even if it's planning for a day just to do nothing, plan certain days so you feel a small form of productiveness. Postpone some important decisions such as getting married, divorce, etc., changing jobs until you feel better. Getting in relationships also. Discuss decisions with others who know you well. Positive thinking will replace negative thoughts as your depression responds to treatment. And where can you go for help? There's mental health specialists such as psychiatrists, psychologists, social workers, or mental health counselors. And there's health maintenance organizations. There's community mental health centers, hospitals, psychiatry departments. There's hospitals, family service, peer support groups, etc. If you know somebody that's in a crisis, call your doctor, call somebody, call 911 or go to a hospital emergency room and get immediate help if you feel like this. If you know anybody that has this, or if you yourself have this, call the toll-free 24-hour hotline of the National Suicide Prevention Lifeline, which is 1-800-273-TALK, which is 1-800-273-8255. and you can talk to a trained counselor, and make sure you or the suicidal person or anybody that you know that is going through a depressive state is not left alone. I know this was random, and I'm just trying to do something new for my channel. I like talking about certain things. I'm gonna try to do these once a week. Hopefully they'll get better. I know this one was the first one. It's not amazing, but I'm gonna try to make these once a week about different topics. Not always going to be about mental health awareness. They'll be about different things going on in the world. Um, my last thoughts, last words about mental health is people are always going to have some form of depression. Always be aware of your friends, be aware of your family, be aware of the people you love, because one day they might not be there anymore. You're not always going to make the most perfect decisions in life, but you can always get better, and you will get better. Um, this is Puddin Pop Podcast, and signing off, guys. Hope you guys enjoyed, and we'll see you guys next week. Peace.